I want to start this message by extending my thanks to you, the almost 5,000 people working in Tusla across so many different services right around the country. I also want, in the particular circumstances we find ourselves in, to acknowledge the role of the staff in our many partner organisations. All of you together play a vital role in continuing to support children and families in a variety of situations, some of them in very vulnerable circumstances, and many of them requiring ongoing protection, care and support. Today, I want to address a couple of key messages. Tusla has been preparing to ensure maximum continuity of critical services during COVID-19 and all of the necessary social measures and restrictions on movement that are currently in place. I have appointed a dedicated crisis management team. Together with the senior leadership team, this group of professionals meet on a daily basis, every day of the 7 days, and we will continue with that initiative right throughout this current challenging period. Based on the best available advice to me, I have identified 3 critical service areas to which I am now directing the entire focus of the organisation. These 3 service areas are frontline child protection, including our out-of-hours service, children in care, of which there are 6,000 in Ireland today, and domestic and sexual gender-based violence services, supporting thousands of adults who experience significant difficulty and trauma in their lives. Many of our other services are also important, and I want to recognise that. But for now, these 3 service areas remain our key priority. My first ask of you today is to do your part, to cooperate locally with colleagues and to do what you can to ensure the continuity of these services. Many of you watching this video cast will know the families and the children very well, the ones about whom there are perhaps the greatest concerns, the ones who perhaps need the greatest level of contact and support. I'm asking you to use the guidance issued by the crisis management team and your own professional judgment to ensure we do everything possible in the current restrictions to support the people, the children and the families who come into these 3 service priority areas. I now want to talk about the workforce. I've said many times since I came to Tusla last September, Tusla does not do its work through technology or machines. Tusla is a people organisation providing largely relationship-based services. In the context of social and physical distancing and all of the advice in relation to protecting health, that makes our work particularly challenging. But nonetheless, there are aspects of our work which are vital and essential frontline services, and therefore we have to balance risk and take appropriate steps, not only to protect the public, but to protect you, the workforce. My ask of you today in this context is to do everything you can to put yourself forward, to change your work pattern, if requested to change your work location, to work from home, or indeed to use your skill sets from the past, which many of you have, and possibly redeploy to supporting the 3 key service areas that we have identified. This cooperation and this utilisation of the skill set of the entire workforce will be vital to us sustaining these 3 key service areas during what is an unprecedented challenge for all of society. I also want to talk about you, the workforce, in the context of your health, your own health. I have no doubt that a number of you have or will be affected by the arrival of COVID-19. You may be affected in your own health, and you may be affected in the health of your family, or indeed you may experience challenges because many other services are not available that you yourself might utilise, such as creches, preschools and schools and other services. I want to assure you, as your employer, that Tusla will do everything to support you and to facilitate you if you are impacted by COVID-19 or any of the related measures. Practical ways in which we have been supporting the workforce have not only been in providing detailed guidance from the crisis management team on how to work. Our organisation is very fortunate that with a small but dedicated ICT department, we had, before the arrival of this crisis, 3,500 staff, all of whom were remotely enabled with the latest versions of technology to be able to work smartly and remotely. We've now increased that number to 3,800, and I envisage very shortly, and before this crisis has passed, that over 4,000 to 5,000 people will be enabled to work remotely. I do want to recognise that because of the critical services we've identified, it's not possible for all of our staff to work remotely. There is a requirement for us to continue to engage with the most vulnerable and to work on the front line. In doing this, I want to assure you that in all of our guidance and in all of our support, we will do this in a way that best supports your health and indeed that of the people that you need to engage with. Very often in a time of crisis, it's when we see the collective work of so many people at their very best. I've engaged with many internal and external stakeholders and continue to do so, talking directly to many of our partner organisations who are critical to us being able to continue to deliver the three key service areas for us at this time. I want to extend my thanks to everyone, both inside and outside the organisation, the many other agencies, An Garda Síochána, the HSE, the Department of Children and Youth Affairs, and indeed the Minister for her support to the efforts that we are currently making. A lot of information and a lot of detail is in circulation about COVID-19. I'm asking you, as public servants, to ensure you take your information from the reliable and trusted sources, from the National Public Health Emergency Team led by Dr. Tony Houlihan and the Health Service Executive led by Paul Reid. They are the official sources that Tusla is relying on to keep you updated. For all of the information that you need and that is currently available, both in respect of COVID-19 and Tusla's guidance on working through these times, you can visit the dedicated link on our website at tusla.ie. Mehil, the traditional Irish concept, is well known to many. It has a particular relevance in Tusla because we use it formally in our family support systems. We're now called on to use Mehil in a different way, a different type of Mehil. The entire workforce of Tusla coming together flexibly with a willingness to do all that we can to support the people who most need us and to support each other in coming through this very difficult period. Finally, I wish you and your families safety and well-being throughout this time. And we will continue to communicate with you daily and weekly through a whole variety of means. And we will ensure that you have the latest and up-to-date information and support in order to keep you well and in order to continue to support those who are most vulnerable and those who need us most at this time. Thank you.